Welcome to Demming Chronicles, where we chat with citizens who have ideas that are different. Those are ideas that they've taken a chance to develop, and those ideas can make a difference to our country. Demming Chronicles, Season 2. We welcome Idi Stewart.
Hi, thanks for having me.
Thank you very much, Idi. And we also welcome Gabrielle Hosein. I call her Jamila.
Hi, Denise. Hi, Idi. Hello to your viewers.
Demming Chronicles. We'll be back with you shortly. Welcome back, Demming Chronicles. Welcome, Idi. Tell us, what do you understand to be Trinidad and Tobago's strategy for developing our health sector?
Well, interesting question. First, let me say it's unclear from my point of view what is the actual strategy that the government is employing. It has not really been articulated in a fashion that one can really understand. If we go based on what the Prime Minister have verbally expressed in his public statements, then the way forward, it's really focused on improving the ICT side of the healthcare system to make it more efficient from a database and scheduling standpoint. If one looks at what the political party who is in government is stating, are you here? Sorry.
Yes, I'm just saying that if we're looking only at ICT and buildings, then what do you think will happen? Because the people in that situation comes out very, very critical.
Yes, and that's the next aspect. When we dived in, when I looked at the PNM manifesto, it actually spoke of no new strategy, but rather focusing on physical structures. And this is why we would not really, going forward, not really see the quality healthcare really coming down to the citizen. If the citizen believe quality healthcare comes from being in a new institution, then they could look forward to that happening. However, if they really truly understand what the quality healthcare that focus on efficiency, effectiveness, all these patient-centered care, if we look to focus on these issues, care that is safe, then we are not really heading down that road anytime soon. And we would really want to change course. And changing course will be actually much less costly to the citizen of Trinidad and Tobago, to the government of Trinidad and Tobago. It will cost much less if we make that pivot currently. Yeah.
Idi, you're saying that if we change a strategy, it will cost us less. And what I hear you say is that I would see in the budget, in our expenditure, I would see a reduced expenditure. Could you just dig a little deeper into that to our viewers?
Definitely. So what we have currently is that every year the government seeks to expand the amount of services that they provide from a secondary care standpoint to the citizens of Trinidad, because we as a population are getting much more ill, mentally ill, physically ill, and the government is focusing more on the secondary healthcare facilities. They're waiting on you to become ill, and then they are providing these services, which are much more costly. However, if we focus on models, low-cost interventions, which really emanates from the primary healthcare setting, and we roll out that sector, then you would see less people becoming ill, less people requiring dialysis chairs, less people requiring open heart surgeries, angiograms, all of these things. You'll see a less of that, and you'll keep your population healthy well into the future. Unfortunately, that is not the road we are going on. We are focusing exclusively and very limited. When you watch the budget and you see what is given to the secondary healthcare settings, and then you see what is given to the primary healthcare setting. You see basically chalk and cheese. Less than 10% of our entire healthcare budget goes towards primary healthcare. And that is indeed fortunate. It's not, and WHO, as recently as 2020, have come out with the position paper showing that we need to focus on primary healthcare. And to do that, they are indicating nursing is a primary focus to get that pivot towards primary healthcare. Nursing through district health visitors, nursing through mental health officers, district nurses. This is where we need to place resources and get nursing personnel into the communities and pick up on all of these problems and keep persons out of hospitals. Those persons who would have been discharged from hospitals, there's very poor follow-up care for persons. So you see that revolving door syndrome where persons get discharged from hospitals throughout Trinidad and Tobago, and within 1 month, 2 months, they return right back to the same place. So that is our real challenge as a nation, and we need to look at models that we have right here within the Caribbean and the robust primary healthcare setting that Cuba has. And we always remark that even though Cuba currently has much more cases than Trinidad and Tobago, much more COVID cases, for instance, they have a lower death rate than Trinidad and Tobago. And that is really telling, and that should allow us to look in that direction. Cuba, which doesn't have the amount of resources, but they have been able to do so much more with the limited amount of resources they have.
You raise the issue of nurses, and in my own lifetime, I know that Trinidad used to be a place that we were almost pirated for nurses. So why is it that we have a problem when our nurses have an internationally really good reputation?
Many reasons, and shockingly, all of the problems really have been contextualized and summarized in the Gladys Gafoor Report of 2004, I believe. In that report, they pulled together all the various commissions of inquiry into health sector, and they came up with the recommendations, some of the same recommendations that have been made ad nauseum are currently in that report. So, and one of those recommendations is to retain our local nursing personnel. Sadly, some of the recommendations, if not all of the recommendations, have not been implemented to date. And we are in 2021. Those recommendations came out in 2004. And still, those recommendations have not borne fruit, as it were. So, for instance, there's very, very little opportunity for upward mobility of nursing personnel in Trinidad and Tobago. So when a person becomes a nurse, there's very little room for them to migrate and move themselves up the administrative ladder or the clinical ladder. There's literally no clinical upward mobility. So the only option for a nurse is to become a nurse manager, a head nurse, a nurse supervisor. That is literally all. You cannot move up in the clinical setting. So you could have the best and brightest clinical nurses, and then you will lose them to administration, being coming out of that clinical setting and thing. You also have little opportunity for nurses to upgrade their skills. There's literally no incentive for you to continue your education, to improve your skills, no opportunity. So there's no opportunity and there's no reward if you do it also. So you would get basically the same salary, whether or not you're a dialysis nurse, an ICU nurse, a trauma nurse. There's literally no or very little compensation difference. And when you compare to medicine, a field that we work closely along with, when a doctor specializes, you see that dramatic increase in their salary and their remuneration. When nurses specialize, you basically get a $200 or a $400 increase. So it's simple things like these, which has been on the forefront for years, sadly has not been taken on. So this is why the sign-on bonus for nurses to go England currently is 3 times their salary in Trinidad and Tobago, and that's just their sign-on bonus. So it's really a difficult feat, not only for the association, not only for regional health authorities, but for the Ministry of Health to keep nursing personnel in Trinidad and Tobago as we speak.
Idi, I often think of what are the small steps that we can take to impact the bigger system. What small steps would you suggest?
I believe one of the smallest steps we could take as a nation is to pretend we are a democracy. And I say that because you would be shocked. Well, I'm not sure if you will be shocked, but the nation will be shocked that when taking health sector decisions that will affect all of us, including nursing personnel, who make up 50% of all healthcare workers in basically any country you go to, nursing personnel, nursing and midwifery personnel make up 50% cadre of staff. And when governments and RHs make certain decisions, they would not involve nursing personnel in those decisions. Something simple as that. And this is just any healthcare decision, even though it will redound to impact the quality of nursing care. And what is worse, even if that decision is directly related to nursing. So for instance, we have a nursing council, that's the regulatory body for nursing personnel in Trinidad and Tobago. That is the organization that says if a nurse can practice or not, sets the minimum entry requirements, determines if a nurse has to be disciplined or not. When choosing persons to be appointed onto that board, imagine the government did not speak to nursing personnel. They made that decision independent of nursing personnel. And that has resulted in a position where we are today, where that organization still has not been able to function as how it should be. And that is why there's literally no nursing personnel being disciplined as we speak. So when you hear members of the public complaining of nursing personnel or medical personnel or what have you, we have the government tank for basically preventing the regulatory body from performing as how it should. Yeah. So some simple issues like that, and another a number of the other ways that we could really improve nursing and healthcare in Trinidad and Tobago is just by making continuing education mandatory through all spheres. I know the Dental Council has already put a proposal. I know some of the other professions related to medicine have already put a number of proposals. We too, from the association, the Trinidad and Tobago Registered Nurses Association, have requested and asked the Ministry of Health to change the Nursing Personnel Act, which provides for mandatory continuing education. This would ensure, even though it comes with no additional compensation at this time, it will ensure nurses are practicing at the 2021 standards and not practicing medicine and nursing that what they were taught in their nursing schools from 5, 10, 15 years ago, sometimes 20 years ago. You are practicing outdated medicine. So some simple steps like these, and we have many more, that really improve the quality of healthcare in Trinidad and Tobago.
And as we bring this interview to a wrap, Idi, what is your parting comment? What is your parting wish, your parting expression? What do you wish to say to our viewers?
The Trinidad and Tobago Registered Nurses Association, our primary goal, our main focus is to improve healthcare. And we have come up with a mechanism how to improve healthcare. And we're saying we can improve healthcare, not by spending a whole set of finances, which the country doesn't have, but improving healthcare from within, improving the nursing components, and that is why we are focused on nursing and midwifery to really improve our level of care to our citizens. It's care that they deserve. It is care that we have spent exorbitant amounts of funds to attain, but we just need to pivot in the right direction. And we hope we get that form of inclusion from the respective policymakers, and we hope to be included around that decision-making table for when those decisions are being made. Thanks for having me.
Thank you very much. Idi Stewart, President of the Registered Nurses Association, and on a lovely note to end, inclusion. Demming Chronicles. We'll be back with you shortly. Demming Chronicles Season 2. Welcome back. And on this edition, we have Gabrielle Hosein. I called you Jamela the other as we started. Where did that name come from?
Jamila is my mother's middle name and my middle name and my daughter's middle name.
Wow. So
beautiful.
There's continuity. That is an absolutely beautiful statement there. Tell me, Gabby, what keeps you inspired?
When I speak to young women and I understand some of the issues that they continue to face, I am inspired to try and make any difference I can in the world. When I speak to young feminists and they are really crediting the path that women who have been engaging in advocacy and activism on all fronts, when they credit that path for, providing an example, decreasing their own sense of fear, giving them a sense that change is possible, then I think, how can I do anything but try to continue to inspire? When I talk to young men who are able to be feminists because they can intersect that kind of feminist analysis with all of the other issues that they care about, and I'm so glad we transform the world in which masculinity itself can be progressive and revolutionary and radical in ways that include a gender analysis, I'm inspired. Mostly, however, I feel a sense of responsibility to the world that we live in, and that we must do everything we can to transform it for those who are most vulnerable. And I suppose that keeps me inspired every day.
And Gabby, I'm sure you will be inspired for a long time because those are very positive things and we are seeing a lot of changes. But I want to just raise with you something. I have a male friend who said to me recently, you all have had a prime minister. You all have judges, meaning women. You women, you now have a woman as the president. What else do you want? How would you answer that question?
First, I think it's not about you women. I think it's about us as a society, including men, women, boys, and girls. What do we as a society invested in equality, justice, human rights, and nonviolence want? Not you women. Women are part of our families, our communities. They are sisters, mothers, friends, colleagues, daughters. What do we want for women? So I would have turned around to him and said, what do you want for women is the question. And I think those conversations with men are necessary. I don't think that we should be put in a defensive position of having to justify why we would like to be free and self-determining in the world. And not just those women who can access that because they have educational or class power, but all women. So okay, what do women want? We want a world in which there is zero sexual violence. Girls, from the time they are born to the time they are women and they die, are not at risk at any point in their lives of rape, sexual assault, sexual harassment, or any kind of sexual molestation. We want an end to all forms of sexual violence against all women and girls. That is, women and girls are safe in their homes, in their schools, in their religious spaces where they are so often violated, and they are safe as well on the streets and in their workplaces. Until that is a reality, then we will continue to want it. What do women want? Women want a say as well in the way that the world is determined and governed. I was scandalized at the lack of representation of women in the Prime Minister's recovery committee for the pandemic, and even more scandalized that the one man who represents a men's rights organization that is, hostile to feminism would not have said, I'm here to represent civil society and we demand greater equity in representation of women. So we also want a world in which men are invested in justice to the same. There's no reason why being a man means that you're not invested in justice. That's like saying that white people are not invested in a world in which there's no racism. We want a world in which we are invested in the greatest vision of inclusion for us all across sex, gender, sexuality, and gender expression, as well as in terms of all the other issues that those intersect, like disability, like age, like health status, and so on. We want a world in which there's no discrimination against anyone for any reason. And so what people think about feminism and the long history of Caribbean feminism is that it is a movement by women, for women, but that is not true. It is a women movement in which women have provided intellectual and political leadership and so many hours of labor to transform the whole world. We want a world that is not, in which money is not being spent on militarism and war to the trillions that it is, and is instead spent on mental health care, on daycares, on family sustainability. So what women want is a radically inclusive and transformative vision of the world, a world in which we treat the planet very differently than we are doing right now, because we care for each other, we care for 7 generations down the road in terms of our species and other species. And so to just, conclude, we've had one prime minister, in all of our post-colonial history, and one president in all of our post-colonial history, and minority of women in decision making across political and economic sectors, but a majority of women that remain poor and insecure, a majority of women who are responsible for childcare, a majority of women who are not safe on the streets, getting home from work, not safe getting in a taxi. So we want a different world, and we want it unapologetically.
Fantastic, Gabby. I mean, that is quite a mouthful, and I'm really happy to hear that. But when I look at our parliament, 30% of our parliament comprises women. So is that an improvement? Or what could be done? What could be done to improve the representation in parliament?
30% is absolutely not enough. Had we had 30% of men in our highest level of political decision making for all of post-colonial history, we would all be talking about the systematic discrimination that men face, and the whole society would be convinced that we needed 50% or more of men so that men could have a voice, could have a say, their needs could be met and recognized and included. And this is absolutely the case now. 30% is simply not enough. It is also not enough given that women have dominated tertiary education for the past 20 years. And so on a qualifications basis alone, both across the humanities and the social sciences and the natural sciences, it is not clear why it is qualifications have not resulted in terms of a shift in decision making, such that we are putting qualified people who, in this case, who are predominantly women, into our House of Parliament. So there is a discrepancy between our obsession with arguing that there are too many women getting degrees and the unremarkable status of the fact that they are then excluded and face a glass ceiling in politics. 30% is absolutely not enough. However, we all know that what we want is not just women to go in. The numbers are important, and they're important on their own terms. Right? Secondly, we want women who are then going to go in and be transformational leaders. But we don't only want women to be transformational leaders when they're in there. We want them to demand that their male colleagues are also transformational leaders. This is not a responsibility that we can put on women alone. This is an issue of justice in which all of us must be invested, regardless of who benefits. It's not just differently able people that must struggle for inclusion of differently able people. We must all do it, because that's who we want to be as human beings. We want a world in which we are all caring about each other. And so some of the strategies we know have to do with giving women training and access to funds to help with their campaigns, giving them a basis for learning how the political system can be managed. But also we have to make better demands of political parties. Not a single political party has its own gender policy, sexual harassment policy, or position on what they expect out of equity in the party. Not a single political party puts, for example, when we have women in parliament, we don't only want women like myself who may have 3 degrees and who, represent a different class of women. We want Ida LeBlanc from the National National Union of Domestic Employees as a working class woman to be able to be in the parliament to represent from her perspective what working class people want to say to the nation and how they read laws and policies. So these changes are institutional. They demand better both of the political parties, and they require that we demand better of the political leaders ourselves, that they are held accountable for not making those kinds of shifts and setting those kinds of examples. And so this is absolutely an area of women's exclusion. It is absolutely a sign of the glass ceiling, and we absolutely have to demand at least 50%, and we have to demand that both women and men be invested in that kind of transformation.
But what is your response to the view that women are just not coming forward?
Mm-hmm. So that's never been the case. So a long time ago, I mean, the Caribbean feminist movement has been active since the 1970s. And even as early as the 1990s, when Hazel Brown and the network of NGOs of Trinidad and for the advancement of women began to do this work, they would say that they couldn't find women to go on boards. They'd be 100% men on a board. And they would say they couldn't find women. And so the network would produce a list of 200 women and say, here, we found those women. So there's a particular way that we blame the push factors, right? That is, we blame women for not going into these positions of leadership. But we also don't recognize that the ideological and institutional system itself is not making the effort. So today we don't say, companies don't say, you know what? If there's sexual harassment, you make sure come and report it. Companies have sexual harassment policies that are preventative, where they set what the norms and the regulations and the ethics and the values and the vision of a company is in relation to that issue, because you know you can't rely on individuals alone to challenge a structure and entrench norms. And so all corporations, you know, and boards should establish this as a particular politics, that we are looking for qualified women because we are invested in making gender equality and gender equity and inclusiveness, and not just women alone, different kinds of women, you know, across a range of differences as well, including sexual orientation, including gender expression, including disability, including even migrant status, because there are migrants in our midst now who are part of our societies, and we need to get used to that and start building a society in which we understand and relate to each other across all levels of decision making. So I always want to hold institutions accountable, even while we try to empower individuals to make a difference. We know that individuals alone cannot do it, that it takes movements, it takes critical mass, and it takes institutional buy-in.
And as we bring this interview to a wrap, what is your parting comment to our viewers?
My parting comment is to be patient, in the sense that you think, you know, what are feminists fighting for? Surely they have everything they want, but be patient enough to hear why it is we are saying that there is so much more. I would also say that before you shut down, you know, a very visionary goal because you may not have all of the information or understand it all, take the time to just be open enough to listen. And finally, you know, one of our key issues is around gender-based violence in Trinidad and Tobago. I want to emphasize that gender-based violence is not just partner violence. All of us must be fighting on every front to end violence in all forms and in all of the ways that it gets reproduced, from schools to prisons to parliament. And so I would argue that this is something in which we should all be invested. When we end violence in all forms, then we end violence as it gets reproduced intergenerationally. And that ultimately is our goal.
Thank you very much.
Thanks for having me.
Thank you very much, Gabby. Gabby Hosein on Demming Chronicles. Like and share our editions. Drop us a note. Demming Chronicles. Until next time, be safe.